You are watching 2+U Nevada, and this afternoon I am so excited to have an amazing mom and professional in our studios, Dr. Angelique Tay, a neurosurgeon with Sierra Neurosurgery Group. Thank you so much for being here, Dr. Tay.
Thank you for having me.
So you just moved here a few months ago.
Yes. We took a trip after my training, went to Amsterdam, and then we came here.
Well, this is certainly a close second to Amsterdam, right?
Yes, it's wonderful here. I love it, actually.
So, Dr. Tay, we are so excited to have you here because we are learning that you are the only fellowship-trained functional neurosurgeon in Northern Nevada. And for people with Parkinson's, this is a very huge deal because prior to you being here, where would people have to go for care?
Well, unfortunately, they would have to go to Utah, which is about a 6 to 9 month wait. Stanford, the same thing, or they would go to Arizona.
Wow. With you being here, it really changes the game for our local medical providers, right?
Yes. And that's actually what brought me here, part of what brought me here.
Yeah. Being the only one, how much demand, are you already seeing a very big need?
Yeah. So right now we're working on getting information out to the local neurologists and the primary care physicians to make sure that they know that I'm here. Mm-hmm. And I'm already scheduling people for surgery. We're starting late October.
So with you scheduling surgeries already, you treat, and I'm going to run through your list, spinal pain, movement disorders, Parkinson's disease, spinal CSF leaks, epilepsy, and chronic pain syndrome. So that's a pretty big breadth of your practice, and obviously very specialized. Please go into that.
Okay, so part of the reason why I chose neurosurgery as well was that in the beginning, for the trauma patients, you would see people who are almost, about to pass away, and then you do surgery, and then they do a lot better. So that's the hook. And then the sinker was really just the functional part, the movement disorders, helping patients get their quality of life back, people who couldn't eat, who couldn't go out into the restaurant, tremoring, and then it all went away.
And that functional word, that's a key word that you just taught me about. So fellowship-trained functional neurosurgeon, explain the difference in a patient before and after surgery and what that surgery is.
So for the Parkinson's patient, they often have a tremor that is uncontrolled. They can't even eat. They can't even write. They're embarrassed to go out to the restaurant. And after surgery, the tremor is controlled, and then they're able to go and enjoy themselves again.
And it really gives them back their mobility. It gives them back their independence because you don't need somebody feeding you or giving you water, right?
Right. Simple things that we take for granted. Yeah.
Simple things that we take for granted. You know what I also find fascinating is, and this is off camera, I found out that you are an amazing mom of 3 kids, 3 and younger.
Yeah.
And you do this. So let's talk about the mom struggle of juggle really quick for moms at home, watching this show, seeing a brilliant woman like yourself and also raising 3 kids. There's got to be a lot of juggling there.
Yeah, but I'm not doing it alone. We have family here that's helping. My husband's very supportive, also has his own job, but we tag team, and even my partners at Sierra Neurosurgery are very helpful, and whenever I need help, they're also there.
That's so nice. Yeah. That is so nice to hear. And having that community surrounding you, it's so good for your children to see a brilliant mom working and saving lives. That's so important. So you're accepting new patients. How far out are you booking?
I'm actually pretty open right now, so we can get you in pretty fast within a week or 2 right now.
Are you kidding me?
Yeah.
Oh my gosh, in the medical world, you never hear that. Sorry for anyone else in the medical world, but you never hear that.
That's what I came here to be. To be here for people who need me.
Well, Dr. Tay, tell me about Sierra Neurosurgery Group. It sounds like you have a great support system as a parent, but also as a surgeon. What was it about this company, this group, that really made you want to move here?
They always put the patients first. It's not like, let's do surgery all the time. It's what does this patient actually need? Always try conservative measures first. And then if they need surgery, do we offer it? That was one. But 2 is that what people don't realize is that we're all very collaborative. So if we see a patient and we're kind of wondering we should do option 1 or 2, well, we'll talk to each other. So you're getting second, third, fourth opinions without you even knowing.
That's really important.
Yeah.
Well, thank you so much for joining us this afternoon, Dr. Tay. We look forward to seeing you again, and welcome to you and your family for moving here to Reno and it's right after Amsterdam.
Yeah. Thank you for having me.
You're watching 2 Plus U Nevada.